Okay, the next wrap that we're going to do is going to be for a hip flexor strain, a hip flexor strain wrap. For this one, we're going to need a double length elastic wrap. You can either use a 4-inch or a 6-inch, depending on the size of the person. We're also going to need a heel lift. When you put the heel lift on this wrap, you want to make sure that they are externally rotated at the hip. Again, go back to neutral. So they're rotating the whole hip, not just the lower leg. And then you can put the heel lift on there. I also want to make sure that the knee is slightly flexed and the hip is slightly flexed. I also want to make sure that they're down to their sports shirts, their athletic supporter or underwear. I want to apply the adhesive tape to the thigh area. Again, depending on where the injury is, how high or low that you need to go with the elastic wrap. And for this one, when we anchor this, we want to make sure that we are going laterally. Okay, when you start this, and again, if we go around first time, I want to fold the edge of the wrap. Again, have them hold it, and again, pull the elastic wrap at about 75%, pulling laterally. Each time you go around, once you get to the groin, you can go around the hip twice, waist. Again, go to the lateral thigh, and then around to the medial side, pulling up, and back around the waist. Once you go around at least twice, you want to go back down to the bottom of your wrap. Again, and circling around about 50% with the elastic wrap, and again pulling it at about 75% elasticity. Make sure that you finish on the thigh. So, got it? Mm-hmm. If the athlete has good hands, he can hold on to that. You want to make sure that you can either use elastic tape, he can contract. Again, going lateral, around the waist. Again, you can use 2-inch, 3-inch. You can also use 1-inch if you needed to. Circles, make sure that they contract their quadriceps when you're applying this. Again, just goes around the thigh and cut the tape. Again, putting a little fold in the, or a tab I like to call it, on the tape so that you can find it again. And put a couple of those on there if you needed to hold that down. Again, make sure that they're contracting when you use the white tape. You can check the distal pulse. You can check the effectiveness to see if it's preventing hip flexion. And that's it.